we'll kind of start off there. Me and Jen will spend a little bit more time introducing ourselves and the work that we do. And then we do have some other things planned. For instance, we really wanted to talk about the analogy of like the sexual health toolbox and really thinking about what, in terms of like knowledge, resources, skills, access to various things. Maybe it's safer sex supplies. What do we know? What do we need to know? What do we have? And what seems to be inaccessible? And today, really vital to bring, I think, those particular aspects of sexual health and saying that broadly, related to the experience of being queer or part of the LGBTQ community. And of course, like when myself and Jen talk about things through the lens or thinking through how this might be different or distinct for folks that are parts of these various communities. It's always important to know that, you know, everyone's experience is a little bit different. How they define queer, how they define certain things is different. So we really invite you today to, you know, if you have a different perspective or lens on something, to offer that, right? Because one of the most important things I think about when I do workshops is that it's really a dialogue. It's not me here sharing, you know, what I know with you. I really like it to be a back and forth sharing of knowledge, right? Because that's what makes the experience valuable. I've never really seen myself as an expert. I've spent a lot of time thinking and talking with groups of people about sexual health, but everybody, I think, is an expert of their own experience and their own knowledge, and I really want to value that today. So before we maybe do some introductions of ourselves, it's just important to do a territorial acknowledgement. So just recognizing that we're meeting virtually on the traditional and unceded territories of the Lekwungen and Wasanik peoples. And I always like to acknowledge that being a visitor on these lands, there's a lot of traditional knowledges that might relate to sexual health, to relationships, to gender, that might be different through an Indigenous lens. So when we talk about these things today, I think sometimes it's important to reflect on that some of the things we talk about do come from a Western lens or colonial way of thinking. And when we do have opportunities in our conversations to disrupt that or think about our assumptions and judgments related to that, it's always good to do so. So that's something I'd like to offer up. Would you like to add anything to that, Jen, or do you want to go into some introductions?
Well, I think I just want to recognize that I'm not actually in the same territory as you are right now. So I'm actually, I'm actually controlling things or broadcasting from Campbell River, which is the traditional territory of the Lakwilitak, Klahoose, and Comox nations. So that's where I am currently. So I'm a visitor on the unceded territories of those peoples. So we're spanning 2 different places on the island and potentially more depending on where our other participants are at.
Excellent. So yeah, someone just mentioned they're from Treaty 4 territory. And the chat box, just a kind of a side note, the chat box is great. Like if you have questions or comments, just pop stuff in there as we go along and we'll keep an eye on it to make sure we address questions or any comments that you have throughout the workshop. So introductions. So my name is Nick. My pronouns are he and him. So I've been working with Jen, I guess, probably going on like 6 years now, 5-6 years with Island Sexual Health as a sexual health educator. And I also do a lot of facilitation around things like healthy relationships. And in particular, I do quite a bit of work around masculine identities. It's something I'm quite passionate about. So my job, it's rare that you'll see me in the clinic, well, especially during COVID, but pre-COVID times, I'm generally out in the community with different organizations, schools, just groups of people having these discussions. And you'll probably notice as we talk about different things sexual health related, that I'm always really keen to talk about the relational aspects. So I really like talking about healthy relationships, consent. I'm a big fan of talking about identity. So when we talk about sexual health, the lens I always like to include, and something that I'm quite passionate about, is the social factors that inform our understanding of sexual health. And that's all I had, unless anyone has any questions about me, but then I'll turn it over to Jen.
Awesome. Thanks, Nick. So my name's Jennifer Gibson, and I use the pronoun she and her. I have been with Island Sexual Health for the past 16 years as a sexual health educator, and my focus is mostly with youth from grade 8 through 12, and then professional and parents. So I do a lot of work with other community members as well. And I do a lot of focus on probably a lot more on the clinical side of sexual health. So a lot around bleed control and contraceptions, a lot around things like, or contraceptives, a lot of things like sexually transmitted infections and safer sex methods. I do a lot of work in the classroom, traditionally often fit into a classroom setting, although I do a lot of community education as well. And I'm probably most passionate, like Nick was saying before, about being a resource for someone. So I don't see myself as an expert except on my own stuff on a good day. I have those days where I'm like, yeah, like I'm owning this. Like, this is great. I'm an expert on this for myself. And then there's other days where I'm like, I really have no expertise at all. And so when I come to my work at Island Sexual Health, and especially around sexuality, I really come as a resource for people. And I expect that often what will happen is we'll have an exchange of knowledge. And so people have knowledge in their lived experience, people have knowledge in their identity, people have knowledge in their, desires and fantasies and pleasure. There's so many different levels of knowledge that we bring and expertise. And so when I come into a classroom or to a group like this, whether it's formal or informal, I really just come in with resources to share with people. And I recognize that people are their own best experts. And I think that what we really do when we talk about sexual health, and our philosophy at Island Sexual Health is to be a resource in the community for you. So part of your village and network of people that are going to support you to be as healthy when it comes to your sexuality as possible. And knowing that over a lifespan, that's probably going to evolve quite significantly. And so our job, I think, as sexual health educators, and our job as community members, is to walk beside people. And if they need resources, we can be those connections for them. We can often be a conduit of knowledge or a conduit of connections in the community. And I think that probably one of the things that I do a lot of is connecting people with resources and knowledge. And so what you'll see in the chat box, and because I'm screen sharing, I can't see the chat box anymore. So Nick, if you can monitor the chat box for me, that would be fantastic. For whatever reason, when you screen share, it won't bring it back up. So if you can monitor that, that would be great. But you'll see that I put a phone number in there, which is our texting line for youth. And I actually have that line with me currently. So if you have a question, you can text it and we can answer it right here for you. So if you're not wanting necessarily to put it in the chat box for everyone to see, feel free to text that 250-812-9374. And I can bring the question to the group, or I could text you back privately if you wanted to. So maybe if you text that number and you're wanting a question answered in our session, great, just put in session. If you're wanting it just to be answered privately after the session's over, maybe just put private, and then I'll know the difference between that. And that project actually came from the youth that I worked with. Probably, I've been with Island Sexual Health, I think I told you 16 years. I think it was 7 years ago in a classroom, one of the youth in a workshop came up to me afterwards and was like, what would be really cool is if we could text. If something came up for us and we had questions, we could text you after. And I was like, that would be super cool. I'm like, maybe we could start a program. And then luckily we applied to TELUS and they provided us with some seed funding, and we've been able to develop this program. So that is a resource for you way beyond this workshop. Just like Nick and I are, resources for you beyond this workshop. So our email addresses are there. Feel free to reach out to us at any time. And I think that probably, Nick, you're probably no different than me in that I'm always happy to see connections made or connections that are needed by community resources. When someone connects with me and they're like, hey, I did this workshop with you and I was just wondering if you know anything about this, or do you know someone in the community that could connect me with this? I always feel really honored that someone would ask that of me. And so please feel free to, to ask us if there are things that you need. We would love to be resources for you.
Absolutely. And it doesn't have to be, I think sometimes questions come in that maybe fit more about like connecting with queer community or mental health and stuff like that. And if you don't, like you're looking for something, you don't know where to go, it never hurts to send us a text and be like, hey, I'm looking for more queer resources that are here in Victoria. And we have a pretty good relationship with different organizations and groups out there. And not always, but we're generally aware of the different things that are going on, and we can help point you in the right direction. So it's a really good resource. And it's also really interesting too, and I often say this in classrooms, is it's a really interesting opportunity, because if we're, monitoring the texting line and someone has like a really challenging question saying that maybe like they're not sure if they need to come in and see a doctor or not, right? Well, we can even just pop down the hall and speak with the doctor and be like, hey, I got this question. Do you think this person should come in and, get an exam or consult with a doctor? And then a medical professional can make that judgment call. And I think that's just kind of cool, because it's rare that you have, I guess, that quick and easy access to sometimes some medical consultation just through like a text message, right? Of course, we can't do diagnosis and things like that all requires coming in. But we can at least let you know, to find what you need, or if it's important for you to maybe seek out some support from clinical staff.
Absolutely. Yeah. And that's one of the things that we can do even to help people make appointments, because we recognize that, we're people that work in a sexual health center, and we're really familiar and we're really comfortable. And you'll see we have made a virtual tour that is going to take you into Island Sexual Health that we're going to watch in a minute. But we also recognize that, sometimes it's really hard for people to even phone and make an appointment. Sometimes people don't even have like minutes on their phone that they can phone with. They can text and set up an appointment, or they feel more comfortable texting to set up an appointment. So that number, the 812-9374, we can also help to set up appointments. If you needed to come into Island Sexual Health for something connected to sexual health, we can help you with that as well. We can't make appointments for you other places, obviously, because we're not dialed into them, but we can definitely connect you with resources at other places as well. So yeah, utilize that. And of course the number, and I'll give you a slide in a second that'll tell you a little bit more, but it's confidential. So we don't know your name. We know nothing about you. You just send us a question and we'll send you back the answer.
Excellent.
Okay.
And so me and Jen will talk a little bit more about the clinic and do the virtual tour, but in the moment, does anyone want to know anything else about me or Jen before we kind of dive into some of the topics for today? Give the chat box a minute.
Okay, awesome. Yeah, I guess it, for whatever reason, when I screen share, it overrides me being able to see the chat.
They said, I think we're good. So we will carry on.
Awesome.
Great.
Okay. So we wondered if we could play a little round of Would You Rather? And it'll make sense as to why we're asking you to do this. Number one, we do it for an icebreaker, because it's kind of always nice to have a little bit of an icebreaker. And if you don't want to, unmute yourself, you can maybe type it in the chat, and Nick can monitor that for us. So would you rather in your toolbox have a hammer or a wrench?
We have one hammer.
Okay, one hammer. Awesome.
Probably a hammer. Second
Probably
answer.
A hammer. I like it.
Oh, one wrench.
One wrench. Nice. Okay. What about you, Nick?
I'd go with the hammer, personally.
Go with hammer.
Yeah.
Okay.
How about you, Jen?
I think I want a saw. I don't think I want either of those things. I think I want a saw. Yeah. Okay. We'll talk about what we.
Oh, I was gonna say you should tell us a little bit about why you chose the saw, because maybe I would have chosen the saw, but I didn't know. That was an option.
You didn't know it was an option, huh? Yeah. And so, how would we have known it was an option?
Probably, I guess I'd have to ask you.
Yeah, probably. That's probably like a good skill to have in your toolbox, hey? That communication. And sometimes we make an assumption if we're only given two choices that those are the only two choices we can make. I had a little bit of an inside, because I know that, typically you could choose something different. I think I would choose a saw, because I'm not super great with hammers and wrenches. I never feel like I choose the right end. I love how this wrench has the two same like equal ends. Like, I don't think that's typical with a wrench. Wrenches usually have different sizes on different ends, don't they?
Totally, yeah.
And usually I choose the wrong end, or I choose the wrong wrench. And I don't know, I just think saws give you a real sense of accomplishment for me, right? Because you're cutting something, you're modifying something, whereas a hammer, and I guess a hammer's part of a process. I feel like a saw is more of a task. I don't know. Yeah, that's me.
It's good. It's good exercise.
Yeah. Why did you choose a hammer, Nick?
I just think it's a very versatile tool, and I like things that are like fluid and flexible and can do different tasks. And I guess like seems like a lifetime ago, like I did do construction work and stuff when I was a little bit younger, and hammers seem to be a tool that you could do all kinds of things. Like, you even get a screw out of a wall. You can use the pounding end to do nailing, pull things out. You could even use the hook on the back to like help lift stuff, right? So it just always was it was a handy tool, I guess, to have around.
Awesome. Cool. I love it. Okay. Anyone want to elaborate on why they chose wrench or hammer? No pressure to do so. Would anyone choose something different if they knew they could?
Oh, someone said Swiss Army knife.
Ooh, nice.
Very nice.
I like that. That's good. I love the Swiss Army knives that have all the little like pieces in them. Like, I have one that has tweezers. Nice. Like, super fun. I've seen one that has like a toothpick that you can pull out. Like, so cool. I love that. Would anyone choose both if they had the option?
Someone said a screw. That's great, right?
Cool. I like it. Awesome. Okay, cool. Well, thanks for going on that journey with us. We'll talk a little bit. We're going to loop back around to it. So it's not completely unrelated to what we're talking about. Obviously, it's thematically appropriate because we're talking about toolboxes, and these are all things that may be in a toolbox, but it's also going to fit into our whole discussion about communication and our discussion about knowing ourselves and expertise and learning how to use things better, right? Which is one of the things I think when we come and talk about sexuality, we're always progressing. We're always doing things differently for ourselves as we age, as our bodies do different things, as we have challenges or gifts in certain areas, as we know more about ourselves in terms of our orientation and our identities, things like pleasure, that kind of thing, just knowing more about your body that way, which is quite cool. Okay, so let's move on and introduce you to Island Sexual Health. So Island Sexual Health, if you can see the blue arrow or turquoise arrow at the bottom there, we're on Quadra near Mackenzie. So if you know where the Bottle Depot is or White Spot, we're right across kitty corner from those two spots. Number 6 bus goes right by our clinic. So it's pretty easy to get to. If you're someone who uses pedal power or you're a runner, you could use the trail, come across the Galloping Goose, and we're right at the flashing light where Galloping Goose connects to Lochside. And we've got bike racks outside, and we also are up the street from the Bike and Board Shop, which I'm trying to think what its name is now. It's changed its name about 6 times since we've been in this location, and I don't feel like I drove by it the other day, and I was like, I need to remember what the name of it is, and it's completely escaped me. But we're just up the street from there. And basically, we do anything connected to sexual health for someone. So people can come into our clinic. Doesn't matter their age, their gender, their orientation, their ability. Our job is to make sure that you are as healthy as you need to be when it comes to your sexual and reproductive health. And so some people come into our clinic who are in places in their lives where they're choosing to share their bodies with other people, or maybe they've chosen in the past to share their body with another person, or they're planning to do that. Some people come into our clinic who are never going to share their bodies with another person, or they don't have plans to at this time, and it might change in the future. So people don't have to be sexually active to access our clinic. They have to have something connected to their sexual health. So people come into our clinic through the lens of sexual health. So we do things like genital exams. So we might do a pap exam or a pelvic exam, a testicular exam for someone. We might do things like breast and chest exams for people. One of the big things that we do, and it's a newer program with our organization, is our gender affirming care. So we provide assessment and referral and hormonal access to people who are 16 years and above. And this is the only one of our services that is limited by age. So we can do support if someone needed emotional support. We can do that at any age, or if they have family members who are wanting support, friends, that kind of thing. But in terms of the medical care, someone has to be 16 years and above to access that. We do have a wait list for that program. And the last time I checked on the wait list, I think we were at about, I think, Nick, was it 4 months? Does that?
I think so. I think they've caught up a little bit since then. But.
Okay. And so one of the things that I had a youth ask me in the classroom before COVID, of course, was what if someone was going to turn 16 and say they were like 4 months away from turning 16? Could they be put on the wait list? And then when they turn 16, maybe where the wait list is and their age have caught up? Absolutely. That is something that someone could do. So if someone was wanting to come in for assessment or referral or hormone access and they were close to 16, they could be put on the wait list before that. So that is something just to be aware of, because I think, for many people, that's going to be, a great step for them to access care, right? To be able to do that. We, of course, do everything connected to the physical side of sexual health with sexually transmitted infections. So we do prevention in the form of vaccination. So we vaccinate against something called the human papillomavirus, or HPV. We vaccinate against hepatitis B. We also do prevention for HIV called PrEP. And PrEP stands for pre-exposure prophylaxis, which is a fancy way of saying we have 2 medications that a person can take if their status is HIV negative, so they do not have HIV. They can take these medications on either short-term or long-term basis, depending on what their needs are. And what it will do is it will, if they are exposed to HIV, it will lower the risk of them contracting HIV by 99%. It's phenomenal. And in most young people that I work with, one of the exciting things for me is that in young people's lifetime, HIV has gone in the Western world from a illness that is life-ending to life-threatening to now a chronic illness, which is manageable, to now very, very preventable with this medication. And of course, the use of barrier methods like condoms, oral dams, etc. But we do PrEP. And so someone can access PrEP through us. They have to do something called a HERE score. So they do an assessment of what their needs are and making sure that their needs match the medication, because there is slight risks with the medication. And we want to make sure that someone's, the risk equals the benefit. We don't ever want the risk to be more than the benefit to them. But that's one of the things that we do at the clinic as well. It only prevents HIV. It does not prevent other sexually transmitted infections. So we still want to think about using barrier methods and vaccinations for our vaccinatable infections as well. Of course, we do testing, and we're going to walk you through that today. If someone has a sexually transmitted infection, we offer treatment. Sometimes the treatment's going to be really short term. For a bacterial infection, they're going to take a simple course of antibiotics. Other times it might be more involved. So it might be a longer ongoing treatment that we are providing support around. And then of course we do the emotional support, because in 2020, we're in a pretty good place with sexually transmitted infections in terms of our knowledge and our ability to access them. What we're not super, what we haven't caught up with, I think, is the emotional side of sexually transmitted infections. There's still often a lot of stigma and shame and embarrassment that goes along with it. So we do a lot of work around trying to break those things down and to help people be as healthy and well as possible, and to help them recognize that if someone is living with a sexually transmitted infection, if they contract a sexually transmitted infection, they haven't done anything wrong. Right? There's nothing to be embarrassed or to feel regretful or shameful about. It might mean that they need to do something different in the short term, like take medication, for example, and abstain from sex until something's treated. Or if they were living with something like HIV, for example, it might mean they need to do something for a longer period of time, right? So things might look different, but they don't have to take away anything from their life. And I think that's one of the things that we do a lot of, is just normalizing that infections are, you know, a pretty typical experience for many people, and it doesn't have to be anything that is riddled with shame or judgment. Of course, we do things like we test for pregnancy. If someone is pregnant and they want to talk about their options, we're going to give them their options based on what they're wanting to explore. So we're pro-choice, which means that we would refer someone for termination, for adoption, parenting, completely based on the person who has the pregnancy, not based on our values and beliefs, based on their needs and their values and beliefs. We do birth control and bleed control. We also do IUDs, which can be a form of both birth control and bleed control. We give away safer sex supplies like condoms and lube, pads and tampons. So for bodies that bleed, one of the things we believe really passionately is that money and resources should not be a barrier to health and wellness. So people can come in and grab those kinds of things for us. We do education like this. There's our texting line. And everything that happens at the clinic is private and confidential. Does everybody understand what that means, private and confidential? Maybe you could just pop it in the chat box for us.
So far, nothing in the chat box, but if people do have a question about that. Oh, someone said, you do not tell anyone else about what is said or done.
Totally. Awesome. And I would say, Nick, I don't know about you, but this is probably the most common question that I get in the classroom is about the clinic is if I came to the clinic, would my parents have to know? Would my family know? Would my school know? And the answer is no. You can come into the clinic by yourself. You could bring a friend, you could bring a partner, you could bring a support person. We're not going to tell anyone else about you. Sometimes people do bring their family members, right? Because they help them feel safe and secure and supported. That's totally cool. No one would think that was weird, but we're not going to tell anyone without your permission. And there's no way for someone to find out you've been in the clinic. So one of the things that's really important is sometimes people think that their care card is traceable because it has that magnetic strip on the back that looks like a credit card. And they're like, you know, the head of my house, are they going to get like a statement, like a credit card statement of where it's used? No, there's no way to trace that. So I think that's always important to know that we work really hard to keep your information private and confidential. So for example, if we ask for people's consent, how can we contact you? So if you said we could contact you by phone, it's going to come up as private on caller ID. And it also is going to make sure that we don't have any, if we left we'd ask if we could leave a message. And if we left you a message, we would just be like, it's the clinic calling, right? We wouldn't say it's Island Sexual Health calling, because that's a big thing. And that's probably the biggest block, especially for young people, to access sexual health care is the fear of confidentiality. And that's completely understandable.
Excellent. And we did just have a question, Jen. Someone asked if we have dental dams. So yes, that is something we generally have available. So we do have a store on site. Now, things like condoms, lube, you'll see on a table when you first come in, some of those safer sex supplies, period products are available for free. Dental dams, you unfortunately can't get for free through like public health channels, but they are priced quite reasonably at the store if that's something you need or that you're interested in. And since I'm mentioning the store, other things that are available at the store, so we do like prescriptions are filled there, right? If someone's on birth control or bleed control. Pleasure products are available at the store as well, and some other safer sex supplies. Sometimes we have books and stuff if people request them. There's some different things in there. But what's kind of cool and upcoming is, I guess about 6 months ago, we got approved for some funding to carry gender affirming apparel. So we haven't quite unrolled the program yet, but we're hoping to have stuff on our shelves early to mid fall. So hopefully by the end of September. So this is going to be things like chest binders, packers, STPs. We did a lot of consultation with the community through surveys and stuff to ask what people wanted. And so right now we're just kind of figuring out, well, what kinds of things do we want to carry, making sure we have lots of different sizes, skin tones of these various products, and then some staff training, because we know there are sometimes risks for using these products. So we want to make sure that when people purchase something, they know how to use that safely and they're well aware of how to do so. And something it's kind of related to education, that we do quite a bit of work with other organizations and groups in the community. Sometimes we can be a good kind of vehicle to connecting with those other groups. And how this relates back to our clinic is we did last year, and we'll hopefully doing it again this year, is we did a trans ID clinic. So this was in partnership with, it's kind of like the Student Society for Law Students at UVic. It's a group called Pro Bono. And some of these law students have decided to help people submit their paperwork to Vital Statistics so they can have their gender markers changed on things like their passport, their ID or driver's license, and everything. It's really great because it's done in collaboration with lawyers. So really, you can come in for an appointment for your ID, get all the paperwork done, all the scanning, everything sealed away in an envelope, ready to send off to the government, so that can be all changed. So we did that last year in clinic, and of course with COVID this year, things have changed a little bit. So right now we're just talking about how to do that remotely and offer some in-person options. But if that's something that interests you, or if you know people in your community that are looking to have their identification changed and their gender markers and stuff, probably best just to like follow us on social media, because we'll do quite a bit of posting about when that's coming up. There's just so many things that go on in our space. I hope I didn't cut you off, Jen, but if there's anything to add, please go for it. Otherwise, if anyone has any questions, like there's like words on here that like are new to you or you want to know a little bit more about, feel free to pop a question in the chat box and we're happy to discuss that further. Although you can find more information about a lot of this stuff on our website in quite a bit of detail. We have a really good website in that sense that you can find a lot of information up there, and it's updated very regularly.
Yeah, and I think the only thing I'd add, Nick, when someone asked the great question about oral dams and dental dams, although we don't have them for free, you definitely can get gloves from us and condoms and make your own, right? So you can get inside condoms and outside condoms and then make your own, or you can obviously take gloves. And here's the cool thing about a glove. If you use the glove, what you do is basically just take a pair of scissors, and I'll grab a pair of scissors in a minute and show us, but basically you would just cut it open or cut it down the side and then fold it open. And you actually can this will actually cover your mouth and your tongue. And so you can put your tongue in the thumb. So it actually provides more of a barrier, which is really good, because one of the things that we know that we're talking about now is, of course, COVID, and COVID being passed through moisture droplets from the mouth. And so there hasn't been to this point, there hasn't been any research to say that the moisture droplets from your mouth could be, like through oral sex, if it went from someone's mouth on someone's genitals, that it could be passed that way. It, at this point, looks like it's mouth to mouth. But we also know that, in the genitals have mucous membranes. And so we know our understanding of COVID is evolving all of the time. And so that would be a really good barrier that would provide more of a barrier than, say, a condom that especially an outside condom that you cut up, tends to be a bit smaller. The other thing, the hot tip, is non-microwavable saran wrap makes an awesome dam. So, and you can do lots of fun things with it, and you can have as much as you want size-wise, which is kind of cool. So you could use non-microwavable saran wrap for that. You just have to make sure it's non-microwavable, of course, because microwavable has the tiny little pores to let the steam out, and that could let fluid through. So yeah, so there's some options for people for sure. Cool.
Excellent.
Is there anything else in the chat box before we go on? No?
Not so far. I'll let you know if something pops up.
All right. So there's the texting line again, 250-812-9374. It's confidential, right? So any kinds of sexual health questions, we can't give you we can't answer, like, I don't know, if you had like a super hard math question, we probably couldn't answer that for you. It's been a long time. I don't know about you, Nick, but it's been a long time since I did math, and I never did it really well. So I think,
no,
yeah,
not me either.
Not you either. Okay. You can answer things about like synthesizers, right?
Yeah, I can do that. Music stuff.
Awesome. I can answer things about dogs. You probably saw my dog walk by. I can answer things about German Shepherds. But yeah, sexual health, probably we're just your better resource for that. Cool. Yeah. Okay. Should we show the video? Yeah?
Yeah, so I guess we did this early this week on Monday. We decided, you know, sometimes when people are going to book an appointment and maybe they've never been to Island Sexual Health, they're not sure what to expect. Like, where do I go when I get there? How do I find the washroom? What is that experience going to be like? So we put together a clip that basically starts like in the parking lot and walks you through what an appointment might look like. Now, this might be a little bit different right now because of COVID. We have a lot of public health measures in place to maintain people being able to access services in a safe way. So post-COVID, hopefully this will look a bit different, but you will get a sense for during COVID and just kind of in general what an appointment would look like. Now I will warn folks, I definitely found out when making this video that I'm not, I wasn't destined to be a Hollywood cinematographer or anything. So there's some glitches along the way, but I think in terms of functionality, it's a great video to give you a little bit of insight into what it would be like to access our services.
Perfect. Okay, so here we go. Let me pull this up and hit play for you. And you probably have to adjust your volume for participants to the highest just because of the audio quality. So if you can do that, that would be fantastic. Here we go.
Hey, Jen, it's not showing up on the screen. They're still muted.
Okay, hold on. It's not there?
No, it's still the PowerPoint.
Still the PowerPoint. Okay. Oh, you know why? Because I have to stop it and then I have to start it again. Okay. Hold on. Hold on. Okay, let me try. Sorry for this. Technical difficulties. There we go. Okay, you got it now?
Yeah.
Okay.
No sound though.
What about?
Oh, a little bit.
A little bit? Okay, hold on one. You know what? I'm going to, this is what I'm going to do. I'm going to do this, do this, do this. Let's sexual health during COVID.
There we go.
Hi, everybody. So when you come to Island Sexual Health during COVID, you'll see that we've got a whiteboard to the front of at the front of the door, and it's going to ask you a couple of questions.
Oh, now the video's frozen.
If you're here to pick up a testing kit or
video's
frozen, you're gonna
no, it's good now.
On the left-hand side of our front door. If you're here for an appointment, you're going to line up on the right side of our front door. So when you arrive for an appointment, read the whiteboard. Left if you're picking up supplies, right at the door if you're here for an appointment. It's going to ask you to text us to let us know you're here. Just follow those instructions, and then we're going to ask you to line up behind the yellow lines. And of course, as we all know, we're practicing safe social distancing, so the yellow lines are what are going to help us mark that. So just head up here, stand here, and as you have text to let us know that you're here, they'll be calling you in order of your appointment. So when you arrive to the clinic, you'll see this whiteboard outside the front door, and it's going to give you instructions.
If you're here to pick up a testing kit or pills, you're going to head to the left hand of the front door. If you're here to pick, or for an appointment rather, you're going to line up on the right hand side of the door. Just follow the instructions that are clearly written on the whiteboard, and someone will be attending to you as soon as they can. Hi everybody, I just wanted to point out that you don't have to have an appointment to pick up supplies from our clinic.
So we always have a table out that has safer sex supplies in here and bleed control supplies in here.
And in the middle, in the orange tote, are free safer snorting supplies. So you can come by and take whatever you want. They're labeled very well on the bags so that you'll know what you need and what you don't need. Feel free to take more than one bag, totally fine. If you're here for an appointment, when you speak with someone on the phone, they're going to call you back. They're going to ask you the questions, do a COVID check-in just to make sure that you're feeling well that day, you have no symptoms, etc. When you're ready to come into the clinic, they're going to ask you to sanitize your hands. So just take a quick minute to sanitize your hands. Someone will come out through that door and they'll escort you into the clinic and they'll take you right to where you need to be. So when you come into the clinic, if you don't have a mask already, we'll provide you with a mask. So we can either provide you with a medical mask that's disposable, or we can provide you with a reusable mask. We'll require you to wear that mask for the entire duration of your time at the clinic. So they will ask you on the phone if you have a mask, and if you don't, just let us know and we'll bring one out to you. So awesome patient, if you were here, for example, for a testing kit that had been prearranged, or if you were here to pick up bleed control or birth control supplies, the clinic ambassador would bring a brown paper bag like this to you. You just wait outside the door, they would come, sanitize their hands, hand it off to you. When it's time to come into the clinic, you'll have the clinic ambassador will come out and call you, they'll bring you into the clinic, and they'll take you through to your appointment into the exam room. In our typical clinic, what would happen is you would be able to enter freely, and this would be an actual waiting room. But for COVID concerns, we have obviously closed the waiting room because we aren't able to maintain safe social distancing. So when we return to a new normal, you could come into the clinic at your will, you would come up to the front, and as a receptionist is available, you'd go to the front of the line and chat with them through the plexiglass. They would be able to book appointments for you, check you in, etc. Now, because we're doing things differently to maintain client safety, you'll be brought into the clinic, taken directly into an exam room, and then taken directly out afterwards. Hi, awesome patient, come with me. Just come down this hall. I'm going to take you into an exam room. We're going right in here on the left-hand side. And if you were here to see a doctor or a nurse, we'd ask you to sit on the black chair and wait for them. Hi again, awesome patient. This is going to take us through what would happen after you had a seat and waited for the doctor or nurse. What would happen is the doctor or nurse would come into the room, they'd have a chat with you, they'd find out, ask you questions about your sexual activity, your overall wellness, your health, any concerns or questions. That's a really good time if you have questions to ask. If you want, if you're someone that has a hard time remembering all kinds of details, you could bring in a list of questions. That would be great. If you, in regular time, if you wanted to bring someone to support you, to help you with the questions and other information, we would definitely welcome that. During COVID, we've modified things and we only need to be able to see the patient, but you could bring someone to support you and they could wait for you in the car or outside the clinic to support you. But if you come in, you're going to chat with the doctor first, just so you can develop some comfort with them. If it's determined that you need an exam, what they're going to do at that point is they're going to leave the room and leave you to change. And often people are in a big rush. They think that the doctor's, in a hurry to get back in here, but here's a hot tip, that the doctor actually waits outside the door until they can hear that there's no motion in the exam room, and then they'll knock. And if you say that it's okay and you consent to them coming in, they'll then enter the room. So if they leave the room and they ask you to change, we ask you to change depending on what parts of your body you're examining. So from the waist down. Here's a hot tip, is to leave your socks on, because the floor can be cold, and if you have to put your foot in these foot rests, they can be cold too. So leave your socks on. You're going to, most times, they're going to ask you to take a hop up onto the table. You'll see there's a stool. You just step onto the stool, sit down onto the table, and on the table you'll see a cloth drape. Just cover yourself up with the cloth drape. That's actually what lets the doctor know whether you're ready or not. So once they stop hearing the rustling of the paper, they know it's time to come in. So take your time doing that. Cover yourself with the cloth drape. They'll knock, they'll come back in. They'll then come into the exam room. They typically will have a face shield as well as a mask. They also might have a gown on, depending on what type of procedure they're doing. They'll come in, they'll wash their hands again, and then they're going to glove up again. And then, depending on what type of exam, they'll then explain what they're doing to you before they do the exam, so that you can give consent and prepare yourself as we go along. So this is a speculum, and again, it would be used for someone who has a vagina and a cervix, ovaries and a uterus, and it helps us visualize the inside of the sexual and reproductive system. Of course, we can see the vulva on the outside, but we can't see the vagina, we can't see the cervix, so this helps us with that. So you can see the base here looks pretty wide. We have a light that actually goes in there to help us illuminate what we're trying to visualize, and then this is the part that's going to go into the vagina. Now, if you have a look, we often look at it and we think, like, oh my goodness, like, it has to, how far does it have to go into the body? It only goes into the body about that far. And what it's going to do is the doctor or nurse, the healthcare professional, is going to open it slightly like this. It will be lubricated on both sides to help it slide into the vagina, and then that helps to separate the walls of the vagina so that we can visualize the walls of the vagina and the cervix. If we're doing an exam where we need to take swabs, for example, first thing we're going to do is we're going to use a large swab like this to just clear away any fluid that would be in that part of the body so that we can visualize things better. If we are doing a swab for sexually transmitted infections, for example, or for some other type of infection, we then, speculum still in place, we use the swab like this, goes into the center, we take a sample of the fluid, it then would go into a tube and it would be sent to the lab with your information on it so that we can identify whose specimen is whose. If we were doing a PAP, what we would do is we would use this cyto brush to take a few cells away from the cervix, we would take them away gently, we would put them on a slide, and that would go to the laboratory to make sure that your cervix is healthy and normal. That begins at the age of 25 if someone has a cervix and they've had partnered sex before that. After the exam, we're going to remove the speculum and dispose of it. Now, with a speculum exam, it shouldn't ever hurt, but sometimes because we're separating the walls from the inside, you're going to feel a little bit of pressure. If you are a person who has a penis and testicles, it depends on what type of exam we're going to need to be doing.
If we're testing for sexually transmitted infections like bacterial infections, we're simply going to get you to go to the bathroom and provide a urine specimen. And you're going to provide enough urine to fit between these two black lines you can see.
So when you come into the clinic, it's always a good idea to be able to pee. And you can let them know at the front, do I need to pee? Like, am I going to need testing to pee today or not? The worst thing to do is to come into a clinic when you can't pee, because it's going to take you a long time to be able to achieve that. So come in having a full bladder, and then we're able to take a specimen. So if we needed to do any other type of exam, so just looking at bodies, we can do that in this room as well. Pretty easy to do. One of the big questions that people have when they come into a clinic is, like, is it going to be awkward? Is it going to be embarrassing? What if I haven't trimmed my pubic hair? What if I haven't shaved my pubic hair? What if I'm pierced? What if I've shaved my hair into a fun shape? None of that matters to us. Whatever you want to do with your body is great. With us, once we've seen one set of genitals, we've seen lots of them. And our job is to make sure that they're healthy and that they're working well, right? Whatever you have is unique to you, and our job is just to make sure that they are healthy and normal. So that's an important thing to know. If someone needs to be tested for sexually transmitted infections and they don't require an exam, we can give them those swabs to do themselves in the bathroom, and we give you instructions on how to do it, and that can be really helpful if someone, for example, doesn't feel comfortable having a physical exam. They don't have time to have a physical exam. If they just need really routine testing done that doesn't require an exam, they can give us a urine sample and they can give us a swab. And they might be swabbing the vagina, they might be swabbing the rectum, or they might be swabbing the mouth. It really depends on what parts of bodies people are using for sex. And that's going to be one of the questions that's really important to be honest with when the doctor or nurse asks you, so that we know what parts of your body to test for.
So after all the testing's done, the doctor or nurse will leave the room and leave you to change back into your clothes again. You don't have to rush, take your time. The room will be cleaned afterwards for you, so don't worry about cleaning the room. Often people are so polite, they try to help with the room clean. You don't have to worry about that. We've got that under control.
Have a seat back in the black chair. The healthcare provider will come back into the room, and this is an opportunity to follow up with any questions you have or any other concerns. At that point, the doctor usually or nurse will tell you what to do, what your next steps are following that. So awesome patient, if we've asked you to give us a urine specimen or to do self-swab, we're going to ask you to go to the bathroom. So I'm going to take you down here. You're going to come out of the exam room. You're going to head this way. And you'll see the universal sign for washroom on your left-hand side. And you'll just follow into the open door, come into the bathroom, and all the instructions on how to do collection will be on the wall. So you might be collecting urine for sexually transmitted infection testing, pregnancy testing, or potentially a urinary tract infection. So all the instructions will be there. If you were to be doing a swab, they would be there too. And what you would do is collect your specimens, you put them back in the bag like this, and you're gonna return them across the hall to the reception desk, and they'll take it and process it from there. So when you finish seeing your healthcare provider, you'll be escorted back out of the clinic. We'll ask you to sanitize your hands again. And then if you've borrowed a mask, you'll return it to us. If we've given you a disposable one, you'll dispose of that, and we'll let you out of the clinic.
Excellent. So that's like a pretty good, like comprehensive video of what an exam or accessing our services might be like. And maybe just a question out to the group, or two questions. First of all, is there anything that came up in that video that you'd like to know more about? We're happy to answer those questions, and you can just put that in the chat box. The second thing is realizing that this little short film probably won't win any film festival awards. We're totally wanting to make another one. So 2.0, something that we can maybe put on our website so that anyone accessing our services can log on the website and do a mini tour to maybe be a little bit more comfortable with accessing our services. So first, do you have any questions? You can put those in the chat box. And then the second thing is, do you think this is something we should do another improved version of and make public so that people, will people find that helpful or useful? I'll open up the chat box so I can see.
Nick, we also had two questions come through the texting line.
Oh, nice.
Yeah, so the first one is, what is the easiest way to get dental dams? They're also expensive and hard to find, totally. So I think we currently sell them for under $2, but that's for a single dam, right? So I think we sell them the cheapest, and I think the challenge, especially for youth, is usually where they're sold is through sex shops, and sex shops often have an age limit. You have to be more than 18 to be able to access it because they also sell pornography. That's what the sort of caveat is there. So we sell them for $2. So the easiest way to get them, you can simply come to the clinic and you just text. When you get to the clinic, you just text and say you'd like to buy some dental dams. Or you can also text the line and say if you wanted to buy some, and then we can arrange to have them put aside for you. And then of course the easiest way would be, or the most feasible way, non-microwavable saran wrap or making them out of gloves or condoms. The next question is, what is the youngest legal age to begin hormones or hormone blockers without parental consent? That's a fantastic question. My understanding is you can be declared a mature minor, which means that you can consent to accessing either blockers or hormones as long as you you can be able to give your own consent, right? So with our organization, we use the standard of 16 years and above. And the reason for that is that's typically a fairly standard procedure for people who are wanting to use feminizing or masculinizing hormones, because their process of puberty has often, it's progressed. Whereas if people are younger, we're going to use a blocker, and then what we would use is hormone therapy in addition. So we are actually not doing the hormone blockers at our clinic. Now, I'm not sure, Nick, if that's something that people could access. I know typically, I think it's accessed through an endocrinologist, but I'm not sure. Is that something, Nick, they offer through Foundry?
I think if they don't offer it directly, they would refer on to doctors in town that are, I guess, experts or offering those types of services to people.
Fantastic. Because I know BC Children's Hospital, they have a whole gender affirming care program now. And one of the things that they have listed on their website is access to puberty blockers and then the feminizing and masculinizing hormones. And they have paperwork on there for mature minors, which means that someone who doesn't have parental consent, they don't need parental consent to actually achieve that. Because in the eyes of the law, you don't have to be a certain age as long as you can give informed consent, which means that you know the benefits and risks of any procedure. Yeah, so that answers
Absolutely.
that. Cool.
Excellent. Those are great questions.
So good.
No other questions in the chat box so far. Just a comment that doing another video would be a great thing to do. So it was really, it's good to know that because I also think it would be worth it. I think people would watch that, especially if they're a bit nervous about coming to access our services. So it looks like we have something to do in a few weeks, maybe Jen, later this summer. We can do the new and improved version without audio overdubs and shaky camera work.
And maybe I can like cool it with the hand gesturing. I don't know. Like I didn't realize that I hand gestured so much until I saw that. That's like ridiculous. I don't know. Anyway.
I think you did a great job.
Yeah, well, you know, you have to start somewhere, right? We're all in progress. Isn't that how we look at it?
Totally.
Awesome. Okay. So let's move on and talk a little bit about Toolbox. Let's move into the kind of the substance here. So if we ask people to think about what's in your sexual health toolbox, what kinds of things would you need in your sexual health toolbox? What kinds of things would you want in your sexual health toolbox?
So yeah, if there's things that you would put in your box, you can just type that in the chat box and they'll give us something to discuss. Protection.
Nice.
Information.
Awesome.
Resources like phone numbers.
Cool. Yeah.
This is a great one. Sexual toys or pleasure products. So pleasure matters they had in brackets, which is actually really great to see.
It sure does. Did you know that today's National Orgasm Day?
I did know that actually.
Yeah, just a little FYI. You know, kind of fun.
That is fun.
I love it. And that's probably, did we talk, I don't think we talked about the pleasure products at the clinic that we sell, did we?
I didn't mention it when I mentioned the store, but I didn't talk about it in too much detail. I mainly just said that they're available. If you wanted to add anything else, Jen, please do.
I think one of the things, especially for youth, because often youth can't access pleasure products like sex toys because they're sold in places, again, where we have the ages of pornography. Although, hot tip, London Drugs has some, and Shoppers Drug Mart now as well are starting to carry some. They're usually on the top shelf, so if you're vertically challenged like mine, you often have to get someone to try and get it for you. Which is totally fine. I'm comfortable with that. But, you know, if you want to be a bit more discreet, but we sell them in our clinic. So we're just in the midst of rebranding and making an online portal for people so that people are going to be able to order them from the store. Because, of course, one of the challenges with COVID is that, you know, because we're a medical clinic, we're limited, like you saw in the video, the number of people that can come in. So at this moment, we don't have space available for browsing. So what we're doing is we're looking at having an online portal in addition to when we are able to open up and have online or like in-person browsing. But we basically have things like cock rings and vibrators and anal plugs and beads, different kinds of lube. I'm trying to think, what else do we have in there?
I think that like basically covers it, like safer sex supplies and stuff as well. But in terms of pleasure products, is a pretty good variety.
Oh, and then masturbation sleeves. That's the other thing we have.
Masturbation sleeves.
We have like the single-use eggs from Tega, and then we have the multiple-use sleeves that are you can clean. which is great, from Tenga as well. So yeah, we have them for all different kinds of bodies and all different kinds of pleasure, and also different price points for people, because we know that a lot of times these pleasure products have been marked up astronomically, and it's really hard for people to actually access. So what we try and do is select products that are really good quality and put a small amount of markup on it that will help us as a nonprofit be able to continue, but they wouldn't, you know, outprice it for people, especially for, you know, people during COVID and younger people who don't always have a lot of disposable income. Hopefully it makes it really accessible to people. And we order products that we know are really good quality and are also very body compatible. So without parabens, not using things like PVC and things that can be irritating, especially to the genital tracts of people. Yeah.
Absolutely. And the idea, I'm really impressed with the stuff. Our store manager, Trista, does a really good job of like curating like products that she, first of all, like, believes in the companies and that they uphold our values around like inclusion and being sex positive and pleasure focused. So she's just done a great job of like seeing everything that's out there and picking things that I think are produced like ethically and for all types of bodies and diverse types of pleasure. So it's really great. And I'm kind of excited. I know that, like Jen was saying, the store is kind of under construction. They're doing some renos at our clinic right now. But I'm excited to see how it all comes together with the brand new store.
I guess, again, like, you know, when we talked about trading expertise in this session, if you have particular toys or brands that you really love, this would be an awesome time for you to recommend it to us, right? So if there's something that you love and you know is really great, we're always looking for recommendations. Cool. All right. So should we move on to the activity?
Absolutely.
Okay, perfect. Okay.
So it was really great to see folks like, I think like information, pleasure, protection. I think it's kind of like, I like to think of it, you kind of get those three things, like the pleasure aspect, which is really what you're aiming for, and the tools that get you there are safety and like knowledge or information. But of course that can be broken down into smaller parts. So what our activity is we have this toolbox here. And there's a number of different things that people might want to put in their toolbox. So again, using the chat box, if there's anything in the list of different items that you'd want to put in your sexual toolbox, let us know, and we'll kind of build what that looks like for people. I mean, we don't have to do this, but I had this vision for this toolbox. I looked for quite a while to find the 3-tier one, thinking that, like, you know, maybe our most essential tools are going to go on that top shelf, so they're easy to access, and then there's 2 shelves underneath, so maybe we'll place things kind of in terms of priority. I was going to say importance, but I think they're all important, but in terms of how well we might prioritize in terms of needs, or maybe things that maybe we won't reach for every time in terms of a tool. So does anyone have anything from the list that's on the PowerPoint there that they want to put in our collective toolbox? Communication.
Okay. Where should we put that? Top drawer, middle drawer, bottom drawer? Let me know. Where would you like? Oops. Where are we going?
Top drawer.
Top drawer. Awesome. Okay. What about sex positive? What do you think that? So I would put sex positive. I'm going to turn it. I would put it in all drawers. I would put it like, and I would make it bigger. I think it needs to like be like that. That's just me though.
I like it.
Okay, cool.
What else do we want to put in the toolbox? I mean, for me, something I would put in my top drawer
Yeah.
would be boundary setting, because I think it's so important for comfort and like pleasure, right? If you're not too sure, like, you know, if it's a new partner, not too sure if you trust that person, or how they're going to take, like, you know, maybe rejection, or maybe saying like, I'm not comfortable doing that activity. It can really get in the way of like things like pleasure or communication. So like being comfortable setting boundaries and then respecting other people's boundaries is a really big one for me.
Okay. Awesome.
The next one, someone said knowledge, and that's a top shelf one as well.
Top shelf. Okay. Awesome. There we go. Cool.
Critical thinking on the top shelf.
Critical thinking on the top shelf. I like it.
And yeah, definitely don't worry about spelling in the chat box. It's all good.
Oh yeah. Nah. Spelling's, yeah.
That's why we have spell check, right? I think an English teacher, grammar teacher would not agree with me, but
we're not doing
spell check's good. We're not here to teach grammar.
We're not doing grammar here. We're doing sexual health.
Yikes, I couldn't imagine teaching grammar. I would be a bad grammar teacher.
Yeah, I'm not.
What anything else that we want to put on our, any of the shelves really? We can move things around, we can.
What about things like gender safety?
I think gender safety is something I would put on definitely the top shelf as well.
And that
like
might
it kind of fit. Oh, sorry. Go ahead, Jen.
Oh, I was just gonna say, I wonder if that's like, oops, now I'm moving the toolbox. I wonder if this is almost like something that should straddle all of it. I don't know.
Yeah, like if it was me personally, I would put gender safety like kind of like almost connected to the critical thinking piece.
Yeah.
Because I guess I'm thinking kind of expansive, because even like gender safety, I would think about other topics and using like that term like intersectionality. So nice. like what about, how does colonization intersect with sexual health, gender, sexual orientation, someone's ability? Right. It's such a big piece of that. So like critical thinking is so important when you're in relationships, any type of relationship really, with people from different experiences and backgrounds, right? So being able to be reflective and take like feedback. Sometimes it can be hard when someone's like calls you out on something, maybe getting a pronoun wrong or name wrong, or making an assumption about someone's experience or background relating to their identity. Yeah. Is just being able to gracefully accept that and learn from it to move forward with it.
And I like, for me too, especially when it comes to sexual health, the critical thinking like of self, like that reflective thinking, and as our identities evolve and as our experiences evolve and as our like even physical beings evolve, I think that's such an important thing. Like it's an important thing to be doing on like the bigger scale and the smaller scale.
Absolutely.
Cool. Okay.
Does anyone else have anything they'd like to add to our toolbox?
We kind of talked already about things like gloves and dental dams in terms of like someone said protection. I guess we can, let's move.
And someone actually just mentioned condoms. So, and they said top shelf.
Top shelf. Let's move her on in. All right. Dental dams here. People all know when I say dental dams, we often use oral dams interchangeably as dental dams. What about things like STI testing?
Oh, someone brought up a good point. Someone said, I feel like instead of condoms on top shelf, it should be generalized as protection. Oh. And I like that, right? Yeah, that's actually quite important.
Why don't we? That could be like an umbrella, right? So like we have an umbrella term of like protection. So why don't we, let's put in here.
Oh, and I think that's really important. And I think that's kind of fits in with being sex positive and gender safety and thinking about identities, because not all people are going to be having the types of sex that are going to need like either an external condom, or maybe dental dams are more fitting to the types of partners they're sharing bodies with.
Yeah.
So yeah, condoms can actually be really specific and might not actually apply to a lot of people in a lot of relationships.
Totally. Okay. Let's make that a little bit bigger. Awesome. Okay. Should we move that? How's that?
That's awesome.
Here, or should we move down here? I like this. I wish we could like click it and it would move on its own. What about supportive adults? Especially as young people, do you think how important is that to your sexual health toolbox, to have a supportive adult?
One person said very.
Okay, awesome. That over then. Cool. What about allies, friends? And this could be of any age, right? Doesn't have to be adult people, like your youth people.
Absolutely. Well, especially like kind of funny thinking back to doing school presentations.
Yeah.
It's really interesting because how it will generally work is, maybe I'm at a school and I'm there kind of for the week and going to different classrooms and talking with different students. And it's really interesting seeing the conversations that formulate after. Like, I actually kind of think that's where some of the best learning takes place is like, at lunch break after people have had a sexual health session and they start talking to one another. And it's really funny because questions that people ask in like a morning session and then they go over lunch, you come back in the afternoon and you'll often have the same questions or something like they're like, oh, you talked about this with another group. Are we going to talk about that? And I always really love to hear that because that's a sign to me that those conversations are happening in allyship, right? Because I can remember what it's like to be, a teenager, but those years are behind me now and it's different for folks, right? So I don't always know like what people need or what they're thinking about or how things have changed since I was in that time in my life. So I think allyship kind of in tandem with supportive adults, because sometimes, as we all know, sometimes our friends give us the worst advice. So we really need to be careful about, who we're asking and making sure they're the person with the correct information that we're looking for. But that just kind of came to mind around allies and talking with our communities about these topics. Sorry.
Oh, I just thought we'll put in sex toys and pleasure matters because someone put that in the chat box. Let's put that in there too.
Excellent.
What about online resources? How are folks feeling about, has there been a shift since we've been social distancing / quarantining? Has there been a shift for folks in how important online resources have become? Does anyone have any online resources that they absolutely love that they want to share with the group?
I haven't seen anything regarding that yet, Jen, but someone made a comment that it's kind of funny that we have nearly everything on top. And that's kind of an interesting thing to reflect on because, I mean, in a very direct way, like, yeah, it's all important, right?
Yeah, totally.
Oh, we've got a couple other thoughts on online resources. So someone said the Foundry probably, or videos on info.
Yeah.
And someone also said, spoiler, porn sites are not reliable sources.
Right, yeah, it's true. While really accessible, not typically the best sources of accurate information. And that's not to say that, because people ask us a lot in our classes about pornography and is porn bad? And I think that, like someone said, fantastic, that, yeah, they're not meant for education because they're not realistic and they often don't show these things that are in our toolbox. They often don't show those things. Some of the more progressive sort of erotica, I would say, versus pornography is being produced with this idea of protection and wellness and pleasure and equality and equity and diversity in bodies and shapes. And I think we actually are seeing a shift in things. Unfortunately, we often have to really look really hard to find that kind of stuff for people, and it's not always as accessible as the stuff that doesn't provide any of these things in our toolbox. unfortunately. It can be challenging for people.
Absolutely. I mean, for me, I think what always comes up with the topic of pornography is just being able to, again, I guess it relates to our toolbox, using those critical thinking skills and looking at the differences between like entertainment and fantasy and education, right? Like if we use what's in like mainstream, like straight cis pornography as our tool for understanding sexual health, that's probably not going to lead us in a good direction, right? So I think that's a really good example of where those critical thinking skills can come in. And someone had a comment, and I'm just trying to relate it back to what the comment in particular was referring to, but I just want to make sure I address everything. Someone said, nope, as long as it isn't a human trafficking site. So maybe that's laws about what's available online.
Yeah. And I think that, you know, that's one of the things we have to be aware of in terms of like communication and boundary setting and setting online relationships, is how quickly they can move and how quickly connection and the critical thinking that we might do in real life often gets, it changes, right? It changes online versus like virtual versus real life, and that we can find ourselves in situations that are much different and much more dangerous than what we expected them to be. One of the things I just wanted to point out, I don't know, can you still see me? I can't see you when I screen share. Can you see me?
Yeah.
Okay. Can you see the book that I'm holding up?
Yeah.
So it's called The Basics, and it's called Drawn to Sex. It's Erica Moen and Matthew Nolan. They do this really cool comic called Oh Joy Sex Toy. And it's an online site. And Nick, if you can you put that in the chat box for me? Called Oh Joy Sex Toy. And they do these really cool graphic safer sex and pleasure based info. And so this is a book. This is just a collection of all of their sex education. So it's called the Oh Joy Sex Toy Sex Education Collection, Drawn to Sex, the Basics. And is
it like OH joy or just O?
Yeah, OH joy. So two separate words. And it's like, it's brilliant. Like, it's so cool. So like, to give you an idea of the chapters, they've got sex, the concept, doing it safely, doing it with yourself, doing it with other people. And so there's all kinds of different things, like from sexual fantasy to response cycle to masturbating with a vulva, masturbating with a penis, mutual masturbation, oral sex for a vulva, oral sex for a penis, how to rock a three-way, sex toys, all kinds of really cool things. And the cartoons are amazing. Like, I don't know if you can see like diversity of body shape and ability and ethnicity and identity. There's some really cool information in there. So that would be a fantastic resource if people are looking for resources. Their online stuff's great. And then this book is good too. Excellent. And then Scarletine, right, is another really good website. We use that lots. Tons of really great information. And they have a book. It's called SEX. But then they have a book for younger people, and it's a comic book as well. So comic book guide to relationships, bodies, and growing up. It's called Wait What? And this is brand new. It's pretty cool. And again, the thing I love about it is so identity and orientation diverse. So like, for example, they're talking about different changes that would happen as bodies grow. If you have a vagina, if you've got a penis, it talks about gender identity through puberty, talks about genitals, and are they normal? Are my genitals normal? That kind of thing. Talks about like all different shapes. You can draw your own genitals in here if you want. It's kind of cool. Yeah, it's pretty awesome. I love it.
Someone just asked, so the website is called Oh Joy Sex Toy.
Yeah, Oh Joy Sex Toy. And it's super fun. I believe they have an Instagram as well. I don't think they're doing TikTok.
Oh, sorry, the second one that you mentioned, Jen, not the Oh Joy one.
Oh, Scarletine.
Scarletine.
Yeah.
Nice.
Scarletine. And it's just one T. So like scarlet, like red, and then een. And it's American. It's based out of Washington. So if you're looking for like specifics around like laws on consent, for example, those will be based in the United States. And like things like abortion or termination or access to like gender affirming care, that would be based in the States. But your basic knowledge around pleasure and bodies and that kind of thing, that's obviously universal. Cool. Okay. Do you feel
Excellent.
like want to move on?
Yeah, we did have an inquiry earlier that we were having lots of great interaction in the chat box.
Oh, good.
But there was also an inquiry about particularly birth control and which has the least amount of side effects.
Oh, good question. Yeah. Okay. So when we talk about hormonal types of birth control, and maybe what I'm going to do, I'm just going to do this so I can sort of see your faces so that I can see what I'm showing, if that's okay. Is that okay? Mm-hmm. So when we talk about contraception or birth control, sometimes bleed control, if we're using hormones, so a person with ovaries and a uterus, what birth control does is it stops ovulation. So it stops your body from releasing an ovum cell every month. It also thins the lining of the uterus and it builds up cervical mucus. So I'm going to show you my super fun pop-up book. It's not going to seem pop-up because we're not in real life, but you can see the system in which those are the ovaries, fallopian tubes, uterus, cervix, vagina. So it stops ovulation, thins the lining of the uterus here, and builds up fluid across the cervix. So it makes it harder for sperm to wake its way through. When birth control, hormonal birth control was first invented, the pill was invented first, and it became legal in Canada in what year? Does anyone want to take a guess at what year the birth control pill became legal? Do you have any ideas?
Someone guessed 1990?
No, earlier than that. And you might have a chuckle when you find out what year it is. Chuckle, I sound like I'm 85. You might laugh. Sorry. 1969, yes, you're totally right. Yeah, and so although it was designed in the late 50s, or it was invented, I should say, in the late 50s, it was 1969 when it became legalized in Canada. So it was first introduced in a pill format. And the pills were super high in hormone. So if you can see those, they were super high in hormone. And the side effects, because they were so high in estrogen and progestin, were quite intense. Now, what we've realized is we can give you less hormone and achieve the same results with less side effect. So when we talk about birth control that has the least amount of side effects, it's going to be individual for one thing, because how hormones affect one body are going to be different than another body. Typically with the birth control pill, we can give you a pill that has about 20 micrograms of hormones, which is pretty low. Now, side effects might be things like breast or chest tissue tenderness, headache. Some people have a bit of spotting between their cycle, bleed, or period. Some people have some mood changes. Now, side effects should go away within 3 months of starting a method. If they don't, that's when we need to look at tweaking the method, right? So although someone might use a pill, they might use a patch that they stick on their arm, their back, their tummy, or their bum, or they might use something like a ring that goes into the vagina and it delivers the hormones through the vaginal lining. They might use something like a shot, an injection that goes into the arm. Although they all work the same way, we just put them into the body differently. Now, what we typically know is that if people had a side effect from a pill, they stop taking the pill, the side effect goes away. So does the pregnancy prevention. Same thing with the patch, you take that off. The ring you take out. The shot is in your body, so it's there for 12 weeks. It's going to take a little bit longer to move through the body. If we talk about the most effective method of birth control that doesn't have hormones in it, would be the copper IUD, right? It's 99.2% effective against pregnancy. There's no hormones in it, and it changes the uterus so that the sperm and the egg can't meet. And it can be used for up to 5 or 10 years. If someone wanted to use, for example, a hormonal type of IUD, they could use these types. There's the Mirena, which looks like this, And there's the Kyleena that looks like that. And this one actually has the lowest amount of hormone in any hormonal method. So it's about 12 micrograms of hormones a day. And so the side effects tend to be less with this. It also offers some bleed control. So if someone wanted to use it to change their cycle bleed, or what sometimes is called a period, they could use it to help with that as well. Yeah, so that was kind of like a wide answer. But typically, if hormones are something that people are concerned about, that would be something just to talk to a nurse or a doctor about, and they would be able to find one that would match for you the best. And again, that's pretty easy to do. All we have to do to prescribe something like that is a blood pressure check and a chat. And even now during COVID, if someone wanted to start it, we can start it with just a simple assessment over the phone. Obviously an IUD, we can't do over the phone. We would have to bring you in and do the insertion, but other methods are pretty easy to access.
So someone just had a question about how do those work? And I'm assuming it's the IUDs.
Oh yeah. Okay, so the copper, essentially, here's your factoid, the copper is actually a spermicide. So the sperm and the egg aren't gonna meet because of the copper, right? The copper interferes the sperm's ability to move into the fallopian tubes. These ones work by thickening the cervical mucus, and they thin the lining of the uterus. So similar to what the pill, the patch, the ring, and the shot, except you would still ovulate if you're using them. So that's what they look like. Yeah. Awesome. And there was another question. Do you know they're testing birth control for men? Yes, for people who produce sperm, they are. And my understanding is there's one being tested in Washington, which is a gel that's put on the shoulder, and it gets absorbed through the skin, and it apparently what it does is slow down the sperm. So sperm are still produced, but they're not as able to quickly move if they were to be introduced to a uterus as easily as possible. And then there's also something called Vasal gel, which is going to be put in the vas deferens, and it's going to be temporarily block the vas deferens so the sperm and the egg can't meet. So the sperm actually aren't released in the ejaculate fluid. Yeah. Cool.
It's about time, huh?
Yeah, I know. It's so interesting. Like, and I think more options for all bodies, right? They want them.
Totally.
And it's also important to know that sometimes people use birth control and they're never going to need it to prevent pregnancy. Maybe they use it for cycle bleeding control. Maybe they use it for other medical reasons, skin. There can be lots of reasons why people use it. So if you hear people call it bleed control and birth control, we use them interchangeably. Yeah. Cool.
Excellent. So many good questions today. We really appreciate that, because we want to be talking about the things that are important to you. So please keep up the great work with questions. We love it.
Cool. Okay. There was one thing, it's a bit of a trick question. There was one thing that was missing from our toolkit. Can anyone recognize what it is? I'll screen share again. Know what it is? So again, Nick, I can't see the chat box for whatever reason. It just...
Someone got it. Yeah. So consent.
Consent. Yay!
Kind of fits, but not listed. That's exactly what it is.
I love it.
And someone also said, kind of a side comment, no worries, it must be a pain if you get awkward silence. And quite honestly, me and Jen spent a lot of time over the years in classrooms. We're very used to awkward silence. You know, if you're going into a grade 5 class to talk about puberty, there's going to be a lot of awkward silence. So we're very comfortable in that. But yes, the online format does come with challenges. It's just not the same as face-to-face interactions. But you know what really helps is like having a great group. And this is a great example of it, where people are asking questions and engaging, and that helps us to hopefully do our jobs better. So we appreciate that. Totally. But back to consent. Sorry, I was...
No, it's awesome. I love it. So yeah, so C is for consent and cookies, both of which I love. I think both of them are amazing, and I think you can mix them together. Would you like to have a cookie? No, I wouldn't. What type of cookie would you like? Okay, so obviously there's a definition of consent. We really in our organization try to move away from consent being this idea of something someone obtains. It's something you're going after. It's like permission. And we really like to work with it as an idea of an agreement. So it's something that all of the people involved in a situation are able to talk about and come up with something that is going to fit all needs. And not just in a sexual context, right? We use consent in our everyday life when we talk about, you know, making plans to go, I don't know, hang out socially distanced in a park, right? Nick, we were talking the other day about how we're using consent as a skill more now than ever, especially with COVID and our risk assessment. And now that we're, you know, we're taking further steps away from this idea of quarantine and social distance to now expanding our bubbles and, you know, involving more people in our social circles, right? So I think we're using consent better than we ever have.
Totally. And someone had a couple of comments about consent. They said, imagine how crazy life would be if it just didn't exist. And then they said plans were made by, you're coming to the movies with me on Friday, right? So yeah, consent is like, you know, it's interesting because I think it's something in one sense we have to get better at as human beings.
Yeah.
But something that we take for granted when people do it well sometimes, right? That we just assume that people are going to do that, and it's actually like a skill and something we have to, you know, be aware of when we're asking questions and stuff. And I really like, Jen, how you brought that kind of into the COVID situation, because I've been, you know, laying low for the most part personally, but, you know, I've had the odd like social distance park meeting with a couple of my close friends, and I really appreciate when someone asks me, hey, like, you know, is it okay if my partner comes as well? And we're going to bring some food, but we're not comfortable sharing food. But if you want to join us for food, maybe we can each bring our own snacks. And just that like information sharing, transparency, and communication, like makes it way more comfortable when you know where someone's at, you know, because I've had other friends that maybe aren't as aware of like wearing masks and sanitation and all that. And it's just, it helps me personally to feel comfortable when I know people are taking steps and able to communicate those steps to me. I don't know if anyone else has had a kind of a similar experience, but being able to communicate what you need and what you're able to provide is pretty important with COVID.
Well, and I think too, like for me, it's like as things evolve, as we have more knowledge of things, right? Like as we have a better understanding of what the risks are and where our comfort levels are and what our unique needs are. Like one person has a lot of different values and beliefs around even viruses than another person, right? Or who lives in their house, or, you know, how much risk they're willing to take. And I think that's one of the things that, you know, we don't do super well when we talk about things like sexually transmitted infections, is we don't always, you know, acknowledge that there's an element of risk in everyday life, no matter what we're doing. And so it's about just assessing risk and seeing where your comfort level is and being able to feel like you can be assertive enough to ask what you need. And also, I think just remembering to be like a kind human being and asking what other people need, not making assumptions about them.
Absolutely.
So I thought it was important for us just to make sure that we're all on the same page in terms of laws, because I think there's so many different facets of consent. And one of the ones that we want to just make sure is that everyone's on the same page in terms of age of sexual consent. Because although this changed in 2009, you know, which is 11 years ago, people don't always know the ages of consent. So just to quickly go through the ages of consent. So if someone's 16 years and above in Canada, they can choose to have sex with another person or people, as long as they're not in relationships that are exploitative, or we talk about there's a power differential, they're in a position of power. If people are younger than 16, we have these close in age exceptions. And so if a person is 14 or 15, their partner must be less than 5 years older than them. So the distance between their birthday needs to be less than 5 years. And with this law, it's so specific that it's no greater than 4 years and 364 days. So it's calculated from birth date of person A to birth date of person B, and day, month, year. Now, I love it in the classroom when youth are like to me, what about if someone's born on leap year? What happens then? I love that question. I think it's always so good, because it is specific, and it would be specifics, right? It always comes down to the actual specifics. Someone asked me, what if one person was born like almost at the same time? And I'm like, well, then it might get that specific again, but that's not our perspective on it. We don't deal with the legal piece of it, but we want people to be aware of the laws that fit within it. If you're 12 or 13, the scope is now less. It's less than 2 years or no more than 1 year and 364 days. And that again is to try and keep people as developmentally similar as possible so that they have like equality and equity in the decision making. Now we know two people could be the same age and they don't have those factors. Developmentally, they're very different. So this is from a legal perspective. And then of course we want to, level it up, right? Check in with our values, our beliefs, our comfort level, our stomach. What does our tummy tell us is a good decision for ourselves? And then if someone's less than 12, it's probably obvious they're not considered mature enough in the eyes of the law, physically or emotionally, to be in a sexual relationship with another person.
And someone just asked, what was the rules for 16 again?
Yes, so 16. So if someone's 16, they could choose to have sex with someone who is also 16 or potentially older, as long as there's not, one of the people isn't in a position of power or authority. So they're not your boss, your teacher, your mentor, your leader, your coach. And the other thing is exploitation. So you couldn't be asked if, for example, someone said, if you have sex with me, I'll give you somewhere to stay. I'll give you money. I'll buy you a chest binder. I'll exchange it for love, those kinds of things, right? So I think that's really important to know. So here when we talk about you cannot agree to have sex if, there we go, you and your partner are drunk or high or sleeping or unconscious. And that seems probably pretty obvious, but we know that when people are in different situations, especially if they're using substance, their decision-making changes. And so we want them to know that in the eyes of the law, that they can't actually make a decision to be in a sexual relationship with another person. And that's whether they just met someone at a party or whether they've been in a relationship with them for like 4 years, right? And then those two, you can see those two exceptions down there. So position of power, like we talked about, or exploitation. We like to talk about consent as enthusiasm. So we want people to be like, yes, that would feel good. Yes, that would be amazing, right? As opposed to, I'm not sure, or no, or I need to be convinced. We want someone to feel with all parts of themselves, their heart, their head, their gut, and their groin, that yes, this feels good. Emotionally, physically, spiritually, right? Mentally, those kinds of things. Yoda is always wise, right? And Yoda says, vulnerable you shall not be, protect you I must with informed consent. So this idea that we're offering protection and respect when we exchange consent with each other. So we see it as an exchange versus, a one-way kind of something you're going to obtain.
And I really like, and that, maybe this is echoing a bit of what you've said, Jen, but really looking at this the legal aspects of consent as like the baseline, mm-hmm. And then the goal being actually pleasure, right? Pleasure and having a positive experience and connection. So when we look at this legal stuff, it's like, this is what's required, right? This is a baseline for everybody. And then we use those consent skills to actually enhance that in a positive way, right? I think that's really important to think about because it is our tool of communication for relationships.
Mm-hmm. Awesome. And we, like we said, we like the idea of consent as agreement versus permission, because when we talk about consent as permission, it's one person giving and the other person taking. When we talk about agreement, it's that they come equally, even though they might have differences, they come equally and they they come into the agreement with this idea of something positive happening. Like, yes, this would feel good, or you know what, I don't think that would feel good. I think this would feel good, you know, or maybe we could try that for a little while, but I'd also like this, right? So it's this idea, circling back to our toolbox, right? When we talked in the beginning of would you rather, hammer or wrench? Well, maybe both, maybe neither, right? So I think this idea of a communication skill, and Nick, one of the things that I love, and I'm going to put you on the spot, but I love that you talk about is rejection, and how people often don't practice consent because they're worried about rejection.
Totally. And I think the language of consent being a practice is so fitting because it does take practice. It's a skill, right? To first of all, I like to think about it in this way. And of course, all human beings are a bit different in this regard. But for me, in general, human beings are really terrible at two things. They're terrible at saying no because you don't want to offend someone, we don't want to upset them. And we might even be worse at receiving no's, right? Because when someone's setting a boundary and they're like, you know what, I don't really want hot peppers on my pizza, they're just setting a boundary, right? But for some reason we take that personally, and in our heads we're like, does that person not like me anymore? Did I do something to upset them? And really we have to get to that place where we almost in some ways like compartmentalize it and think about it as, yeah, no, they're just saying no to this specific activity, right? And as the person not receiving the rejection, but maybe rejecting somebody else. And this is you don't owe anybody a reason. It's not a requirement. But I always like when I'm framing my rejection, say a friend's like, hey, do you want to go to a movie tonight? I haven't seen you in a while. Of course, that would be pre-COVID times. And I'll say, you know what? I'm exhausted tonight. I've had a long day, but I would really love to hang out with you. It's been a long time. Can we maybe set something up for next week? And again, you don't owe people that explanation, but I think sometimes when people know, like, you value them and your relationship with them, but that particular activity or ask that they're putting out there doesn't work for you, sometimes that kind of helps people along the journey of consent. Again, not required, but a thing in my personal life that I find sometimes helps with that rejection piece that sometimes people experience.
Nick, I love that. I was listening to a podcast yesterday on consent, and this person was saying they were a guest on this person's podcast, and they're like, how can we take rejection, like we take it personally, right? We like no feels so personal to us. And I was just thinking about what you said, like someone's like, I don't want red peppers on my pizza, right? Or hot peppers. The hot pepper doesn't take it personally if they're not included, right? But us as people, because we are so close to something, and usually it's because we desire something and we want someone to like us, and there's so many different things, we take it so personally. But if we can strip it back and be like, it's actually about the other person, it's not about you, I think it helps us to accept rejection, right? Yeah, it's so interesting. One of the things they were talking about how to teach consent to small kids, and one of the things they were talking about was role modeling rejection, like having adults role model acceptance of rejection. And I think that's one of the things we don't see adults role model very well to small children, because if we saw adults role model acceptance of rejection, maybe we would learn also how to accept it.
Absolutely. That role modeling is so important. And I love, sometimes I'll do like parent or supportive adult workshops around consent. And parents are so keen. They really want to, like, how do I teach my family or my children or the people in my life consent? Yeah. And I'm like, well, you have to practice it so they can see what it looks like. And they're like, well, Nick, what does that mean? I say, well, like when you come home from work and you see your partner and your kids are around playing video games or whatever, rather than just walking up and giving your partner a hug or a kiss, hello, you actually stop and ask your partner, hey, it's great to see you. I'm so glad to be home. Can I give you a hug? It's great to see you, right? And all the parents look at me and they're like, are you serious, man? I'm like, yeah. Like if they don't see it in their lives, they're not going to learn how to do it. And it's really important. They all kind of give me this look like, I guess you're right, but that feels so awkward. And I think that's one of the things that turns people off from using consent-based skills and language is they feel like it's going to be awkward. And it's not because it's bad or it doesn't work. It's just not something we're used to doing all the time, right? For a lot of people, it's new for them, so it feels awkward. But in actuality, it gets really comfortable to be asking people, you know, is you run to a friend downtown, would you like a hug? And it actually, you know, since I've been doing this work the last few years, it's become such a normal part or a typical part of my language to just be asking people these questions. Even if it's like my dad and I'm going to visit him, I'll say, will you like a hug? And he'll kind of chuckle and be like, why are you asking me that? But I'm like, because I have to, right? I have to, I guess, practice what practice what I preach or what I talk about. And it's challenging sometimes, but it does become more natural. And the advantage to practicing consent in those everyday interactions is when it comes to a more like intimate or sexual relationship. You know, sometimes emotions are running really heavy, people are caught up in the moment, and then maybe those things aren't as front of mind for people. They're focused on like, you know, like, I hope I do the right things, you know, is this person gonna like this experience? And we forget about that consent thing, or the consent pieces of that. But the advantage of practicing it all the time is it's gonna become natural, and you're gonna find yourself just embedding that language into those situations as well. So the more you can practice it and role model that for other people, I think the more we'll see it kind of come out into the world like as a norm, where people are just saying these things. At least that's what I think.
Totally. Okay, I think that's a good segue into our short little clip about consent and what are the ingredients for consent. And we use this really good acronym, FRIES, that we did not come up with. We have borrowed it from our friends in the United States at Planned Parenthood, and the acronym is FRIES. So let's watch the next video clip, and it'll take us through that.
Perfect. And there are a couple of questions I see here. We'll address them after the video, because actually the video might have some stuff that will help us navigate that.
All right, here we go. Awesome. All right, let me see. I'm going to stop share so I can see your faces and I can see the questions that are there.
Excellent. So with the questions, and also Silka mentioned that we could like continue on past the 7 o'clock mark. And I don't know what Jen's schedule is. I'm happy to stay. I think what we'll try to do is maybe wrap up our portion of the stuff that we prepared for around 7, maybe after consent. We did have another activity, but that would probably take a substantial amount of time, but then use that extra time to answer some more questions that you folks might have. I don't know how that sounds to you, Jen, and to everybody else.
You know what? We could always come back because we have a game show. We could always do a game show in another session at some time.
That's a great idea.
I don't know if you'd be, Nick, but
absolutely, yeah. If we wanted to do like the Jeopardy game is a completely different thing. Happy to do so.
Yeah, cool. Okay, what have we got? Good question.
So the first question is a few here. I just want to make sure I get them all. So do you have any resources for people who may be in an abusive relationship or someone is trying to force consent?
Mm-hmm. Yeah. So one of the things that I do is I work with the Saanich Peninsula Youth Clinic. And last week, we had a fantastic resource come and talk to us at UVic. It's the UVic Peer Support Group. And I'll type it into the chat box here. They do a lot around healthy relationships and supporting someone to get out of abusive relationships, or to shift relationships that potentially aren't abusive but they're unhealthy, but the people are wanting to move like into healthy places. So I wrote UVic Peer Pressure. Oh my God. UVic Peer Support. And they support young people who aren't even at UVic. They do a lot of one-on-one meeting with people about, oh, I thought that was Nick. Okay. It says UVic Peer Support. So they do a lot of like one-on-one where they'll meet people one-on-one and they'll help people, just support them where they're at. So they're not a counselor per se, but they can do a lot of work around that. So that would be one resource that I would give. What about, Nick, do you have resources connected to the work you do with Carol?
Yeah, there's a lot of, like, there's so much going on around this. And it really, I think the most important thing about accessing these resources is finding a service where you can be like yourself, where you feel you're valued and respected. Like the biggest one, of course, in Victoria is like the Sexual Assault Center, right? And they can guide people with decision making if they have experienced something unconsensual. But there's so much. There's like at UVic, there's the Anti-Violence Project. There's a lot of programming around consent in the community. I know like AVI in their gender variant drop-in group, so AIDS Vancouver Island does a lot of work around community groups around gender and stuff like that. They have all the time having guest speakers in to talk about things like consent. So there's a lot of resources available. I think it's really finding what works for you. If you're not sure where to go, like I said earlier, the texting line is always a really great starting place. So if you're like, you know, you don't have to give us any information other than like, I need to find resources related to being in an abusive situation, right? Some of the work I do is like with the Victoria Women's Transition House, so helping people to overcome and move forward from being in an abusive relationship. So that's a resource for families. I didn't grow up in Victoria, but since I've lived here, I've lived in a few different cities, I have to say this is one of the like best resource cities in terms of community support. There's just so much out there. And sometimes it can be kind of overwhelming because there is so much, or sometimes things are always shifting and changing. So we don't, you know, there's an organization and they change their name and is it still available? Like really a good place is to just know where you can get generalized information to point you to more directed resources. So like our texting line, like I said, another really good one in town is Youth Space. So it's set up as like a crisis line and emotional support for youth. And I think they, for them, youth is anyone under 30, but they've always kept a really good list of like community resources. They're always really on top of that. And you don't need to be in crisis to contact them. You can go on the youthspace.ca website and you can be like, I need some resources for this. Like if it's related to consent or it's related to gender, and they can have that conversation with you as well. So I guess feeding it back to our conversation about the toolbox is collect as many resources as you can and put them in your toolbox, right? Because maybe you have your go-to resource, but they're closed that day, or you email that resource and they don't get back to you right away. Well, what's your second resource or your third? So part of building your toolkit is not just having that one person or that one community service that can ensure those things are there for you, but looking at all the different options and most importantly, what makes you feel safe, comfortable, and valued when you access those types of services.
And I think I was just gonna chime on to that, Nick, especially about Youth Space, because you can go on and actually chat with a peer support person. So like they can help you, because you know sometimes it's really helpful to get resources, but sometimes we need to like build some skills around how to talk about these kinds of things and ways to lead into conversations about this, especially if you have a friend who is in a relationship and you're worried that that's not the healthiest relationship and you're worried about like, how do I you know, approach them about this, or how do I offer them a resource? What kind of language should I be using? And they'll help you, like Youth Space will help you develop that. I know, like I said, the peer support at UVic also, they're willing to meet people for coffee, like, and even, I mean, if that can't be socially distanced, they'll also virtually meet with people. And like, one of the things that I was really impressed when we had the speaker last week was, our speaker was Megan, and Megan was saying, you know, peer support, it's not the formal counseling approach, but it's this idea of, she was saying that, you know, it sounds like you're in a unhealthy, you know, it sounds like what's happening in a relationship may not be super healthy. Are you wanting some resources? Because sometimes people just want to be heard. They don't necessarily want resources at that moment, but asking someone. And so she was giving the youth that I was working with some really good ideas of how to have those conversations. And she was saying she would be welcome, you know, she would welcome people to contact them and connect with them. And AVP came and also spoke with us. And one of the things they talked about at AVP is they work with people who have survived harm, but they also work with people who may have caused harm. Because that's the other thing, is that sometimes people are in situations where they may have caused harm unintentionally and they want some support. They need some support as well, so they'll offer that as well. And you don't have to be a UVic student to access them either. So I think that's one of the things, is we're not always sure that could we access someone at a university level if we're not, but you can.
Absolutely.
Awesome.
Just going back to one of the other questions that we didn't talk about. Sorry, sometimes we get going and then lots of wonderful ideas pop up in the chat. So if I've ever missed anything, just let me know. But I'm trying to be diligent on making sure we address everything that comes up. So someone said approaches to talking to a cis or non-queer sex partner when it comes to setting boundaries, comfort, identity, etc. And that's really important as well. Right? And it can be challenging. And I think there's a couple things to consider is, I mean, people aren't always going to know what you need when they come from a different experience. And, you know, my experience of being like part of the queer community, maybe not as active as I'd like to be, but it's really like anything else. It's a culture into itself, right? There's certain language, ways of dressing, ways of acting, you know, public figures that are more prominent in queer communities that might not be the case in mainstream. Not always, right? It's quite diverse. But when you're outside of that, sometimes people don't have that understanding, and that can cause harm, right? If someone's not very good with like pronouns or language around bodies, right? Making assumptions around reproductive systems and someone's gender and stuff like that. So this can be quite challenging. And it's hard to say like what's, you know, the model for approaching that. It's really going to depend on the person. First of all, it's not your responsibility to educate other people. And I think sometimes, you know, when we talk about something like decolonization and we turn to that Indigenous person we know and like, please inform me on this. Well, that's not their responsibility. And I think sometimes being in that hot seat to educate people can make people feel uncomfortable. Some people are really keen to educate others, right? So I think it's about assessing how do you position yourself in that. And again, like it kind of goes back to that toolbox, like online resources, right? What can you share with that folks that they can go on their own time and do their learning, right? Because if someone's, you know, going to be in a relationship with you, whether it's short-term, long-term, it could be like sexual relationship or a friendship, is they're making a commitment by entering a relationship to respect who you are. And they need to do the work to show that they can be respectful, right? So that's just something to consider. I think, you know, sometimes people make mistakes and sometimes we want to call them out. Sometimes we feel like it's, you know, not worth our effort in that moment. But that's going to be different for different people. And you just have to basically situate yourself in a way in those conversations that your comfort and your safety is the priority, and anything else that you're willing to offer to that person is really up to you to decide.
I think too, one of the things, you know, we talked a little bit about role modeling. And so if we talk about like in a relationship with a person is like, so this is what I want you to know about me. This is who I am in terms of my identity. This is how I like to express myself. when I act like this, maybe this is actually how I act when I'm stressed. This is how I act when I'm really having a good time. These are the parts of my body that I'm really comfortable with, and I'm comfortable with, you touching. These are the parts of my body I'm not. What about you? Right? And then leaving that to the other person so that they have some options. Because sometimes, one of the things that we haven't talked about, but is that vulnerability, right? And being willing to be vulnerable with someone. And so if we can say, this is who I am, and this is what I like, and this is what I don't like, that can help role model ways that they can relate to you as well. And I think too, like focusing in the positive and the possibility, right? I think we're always worried that things are going to go wrong, but let's think about how we can prepare for things to go right.
Absolutely.
Awesome.
I'm just looking up a consent. Let's see if I can find it. Of course I can. I think it was called, and I might be wrong, I'll keep looking as we're chatting, but I think it's called the Consent Workbook.
Mm-hmm.
And so sometimes we think about communication, we have to think about different ways we can communicate and relate to each other. And sometimes like written or reflective kind of practices can help actually build like a foundation of consent that can hopefully be used ongoing. Mm-hmm. And there's so many different tools out there. But there is, like, for instance, there's one, for some reason I can't find it right now, and I can forward that to Silka if I come across it again. But I think it was called the Consent Workbook. And what it is, it's a PDF, and it's a series of questions about say, for instance, I'll talk about different sexual activities, and I'll say, like, I would be willing or interested in receiving this. I'd be willing or interested in doing this for somebody else. I don't want to do this. Mm-hmm. When I talk about like my genitals, these are words that I'm comfortable using. These are words that I'm not comfortable using. So you can even use that, if you're in maybe a new relationship and you're building that consent, like maybe that's just an activity where you each fill out one of those and then switch and see what the other person has to say. Or even if you want to do it more anonymously, there's a lot of like apps online where you can actually fill out a questionnaire about what you're interested in, what's okay, what's not okay. And basically what it does, it'll show you where the two of you match in terms of common interest or common areas of comfort and safety. So if like that face-to-face conversation is a little bit inaccessible or difficult, it's important to build those skills, but you can also use other tools to supplement that, to actually have a little bit more, have more avenues of communication to talk about those topics, because it's not always easy. And again, that goes back to, learning to get comfortable with consent.
Well, and I think too, like one of the other things that I talk with youth and youth talk with me a lot about is watching shows like things like Sex Education, where it shows like situations where people are in real life situations and being able to be like, I'm kind of into that. Would you like that? Or how, like, that communication style kind of works for me. Like, so being able to personalize things without making it too personal if we're not right there yet, right? There are ways that we can navigate that for sure. And I think, like, again, it's about what could go right and what I would like, as opposed to, what I can't do, right? What can I do? Let's start with that and what that looks like. And it's like you said, Nick, all of this is a skill, right? And the more we use it, the more comfortable it becomes and the less awkward it actually will feel, because we have practice with it, which is so important, right?
Absolutely.
We always say that people should have like 3 checklists, like absolutely yes, and absolutely no, and unsure. And things might move, right? They might move from yes to no to unsure in a situation, in a day, over a relationship. Like, and all of this, because the biggest sexual part of our body is our brain. And so what's affecting our brain think of everything that's affecting our brain. And if we're stressed, if we're anxious, if we're nervous, if we're excited, if we're joyful, if we're, all of these things are going to have effects on it. So I think it's that, stopping, checking in with ourselves, checking in with our partners, and being able to communicate in a really open way. And if we have done something that didn't feel okay for us or with us, that we're able to say that.
Absolutely. And I would definitely, someone just made a comment about being a fan of this show, Sex Education.
I know.
And I just love the comment here on diversity, right? So people actually creating stories about people rather than brownie points for like tokenizing a different type of identity so they can check that box. And there's such a difference between those two things, right? So I think it's really cool to see. I mean, I see this more and more with shows I watch where there's diverse characters and it's not about them being different. They just are different. I don't know if that makes sense. Like, it's not like, no, oh, here's the character that's in a wheelchair and it's not about that. It's just, yeah, this is another person in the story and they just so happen to come from a different experience or have a different relationship with ability.
Yeah. Someone says, does anyone have resources on societal, cultural, gender trauma? You know what? I would say the Sexual Assault Center would be probably the best resource for that. Do you think, Nick? Off the top of my head.
Yeah, I think that's, like, you've identified something that's kind of missing, is a resource that's really looking at the social issues related to gender and sexual orientation, that's looking at that specifically and supporting people through challenges or trauma related to that. Because I mean, there's like counselors and stuff like that that are more, you know, I feel like, for instance, Youth Space is a generalized service, but they'd be totally happy, and I think I'd be a good fit to talk with them about those types of situations. But it is something that's lacking, is something that is specific to, for instance, like the LGBTQ plus community, right? So, you know, that's food for thought, is how can we create services that are specific to that? Oh, and that's actually a great point, is Lux at the Foundry.
Yeah, Lux at Foundry. I would connect. Well, you can connect with Lux through Foundry. You can connect with Lux through our organization. And Lux also works for Transcare BC. So that would be the other resource that I would put in there, is Transcare BC. Because they do a variety of different approaches, and especially, this is one of the we talked, Silke, about the silver linings in COVID, is that our online resources have become much more accessible, and they've moved a lot of things that might have been geographic specific to the lower, like in the Lower Mainland, for example, now is accessible to everyone because it's online. Community would be another one that I would connect with. And it's Queerudition, like that. They'd be another one that I would connect with. Yeah. Is there any info that LGBT plus people know? Certainly, Transcare BC, Lux, and Community, they'll all be LGBTQ plus centered. Pride at UVic might be another one.
Totally.
Yeah, UVic Pride. Cool. All right. Let me write that in there. Okay, is there anything else that we missed there?
Not that I can think of. I'm just kind of being mindful of time. I'm definitely happy to stick around for a little bit if there's other questions and things that we didn't cover, but at the same time, I also want to respect people's time and make sure that they can go enjoy their weekend in a COVID safe way.
Totally. They're long weekend. I could show you, you know what, we could just, I'll just show quickly about, because I did say that I would show you how to make a dam out of a glove. So I'll do that. Just in the questions, they can write them in there. So you could have a glove that's blue. There's all kinds of fun colors. I think I have teal. Let me see if I have a teal glove here that might be kind of fun. Oh yeah, I do. I've also got dams in case people haven't seen dams. There's a grape scented dam. So there's purple, there's grape. I also have banana, the yellow. There we go. So there's the dams. And then if you're gonna make a glove into them, so you could have your preference. You could have blue, you could have teal, you could do both. Or you could just have the natural color. So with this, all you're basically gonna do is just tear it or cut it. Usually these are easier to cut than tear because they're medical. Cut the fingers off the tips like that, except the thumb. So cut this part off. If you can see that. That off. And essentially, you then have this like that, and the tongue can go in this part, which is great. You could also put, if you're putting a finger into the back opening or the anus, or to the middle opening, the vagina, you can also use this as a finger as well. So you could put your tongue in there or your finger, and basically it will cover whatever area you want. So if you're putting your mouth on the vulva, the clitoris, if you're putting it on the anal area, right? Yeah, basically you can just cover it like that, which is kind of cool. So you can make it down. These tend to be a bit thicker, so you might want to use lube with it because that's going to increase the sensitivity and it's going to make the heat wick through a little bit better. But yeah, that's pretty easy to use, right? If you can get gloves, and you certainly can come into the clinic and get gloves from us for free. And then you can also use condoms, right? And I don't know if people have all seen the outside or the inside condoms used as a down, but let's look at that because these are free as well, and they're non-latex. So check the expiry date on it, which I checked, it's 2023. Tear it straight open like that. Unfold it. You can see it's a little bit bigger than a typical condom. What you're going to do is take out the ring in the inside like that. Dispose of it. And then you can do it with your fingernails if you have long fingernails. But a sharp object like scissors is usually easier. I don't have long fingernails right now, so I'll just use the scissors. Now, let's be aware, we don't always have scissors where we're doing these things. But like someone said before, a Swiss Army knife, that would help you too. So just cut off that ring like that, throw that ring away, and then you can tear it down the side like that. And then that, you can see, will cover as well. So you can make a down out of that as well. And it's non-latex polyurethane, which is great.
Awesome. I mean, you could have like a preemptive like dental dam making party out of like gloves and condoms, and
totally
package them up and you'll be ready to go.
Yeah, why not? You can have a craftathon.
Right?
I love it.
And honestly, Jen, I have to say I don't think we've ever talked about, like I've known using the gloves.
Yeah.
I never thought about keeping like the thumb in there because it gives you some more options about how to use it. And that's amazing.
Yeah, totally. I know, so fun. Awesome. I just texted like 3 about the glove. Awesome. Oh, thanks. Thanks for like pushing that out. I love that. See, look at us. Yeah, we're just doing this. It's so awesome. Do you want me to email you about the next picture? Yes, totally. Yes, please. That'd be awesome. Cool. Okay, so does that feel like a good place to leave it and start your long weekend? Which, are they really long weekends in COVID? They're all long weekends, aren't they? I don't know.
One big long weekend, kind of. But not the kind of long weekend you want.
Yeah, I don't know.
It's like the one where it rains the whole time.
Totally. Yeah, let's not say that. No, feels even longer. Someone says, almost all my friends are really sex positive. Makes for a great environment. So awesome. It's so true. Yeah, I'm hopeful about your generation around young people. I think we're becoming more sex positive than we ever have been, and it gives me hope for sure. So no pressure to, pay this forward, but you are. So just thanks for being awesome, and thanks for showing up on a Friday night and, listening to us rant and rave and make love into downs and
and tons of great questions and thoughts and comments about this stuff. Thank you very much for doing that as well, because we have our things planned out, but it's always so much nicer when you hear directly what people want you to be talking about. So thank you for that.
Yeah, that's awesome. And don't forget the texting line. So the texting line, if questions come up, if there's things that you want, if you want to arrange to, pick up gloves, you will see, like you saw, most of you were here in the beginning, but I think someone wasn't, at the front of Island Sexual Health when we're open, Monday through Friday, 9 to 4, Tuesdays or Saturdays, 11 to 3. You can just go and grab safer sex packages. So condoms or brown paper bags that have condoms and lube in them, bleed control supplies as well, safer snorting supplies. If you want gloves specifically, just text our line and we can arrange for you to get them. Cool.
Excellent. And yeah, well, I guess we'll set up a date for part 2, and we can continue on with some of the other stuff. The other part that we didn't get to tonight is centered around like a Jeopardy game around sexual health and gender, sexual orientation. And I think it's pretty fun. So if that's something that's interesting to you or other people that you think would like to attend, we'll keep you in the loop. And I think Silko will be able to pass on that information. We'll set something up because that would be fun to do part 2.
Cool. Awesome. All right.
Yeah, I'll definitely keep in contact once, probably in like 4 months-ish.
Yeah, sounds great.
Sounds great.
Sounds perfect. I've got a little just a little thank you that I'll show you. I think I will anyway. Let's see. There it is. There we go.
A good note to end on. Well, thank you all for coming. Have a lovely weekend. And like as Bonnie Henry says, be safe and kind out there.
Sounds fantastic. Awesome. Thanks, everybody. See you.
Bye.
Bye. Cheers.